I'm going to give you an update on the situation in Australia. I'll be mentioning today the government assistance that people with Prader-Willi syndrome currently can receive, history of our state and national associations, how we went about building organisational and individual capacity, and some other current and future plans. A disclaimer, I'm not a medical practitioner. Government assistance for people with a disability in Australia. Firstly, all Australians can receive free or very low cost health care. On top of that, the government subsidises many of the essential medications so that there is only a small co-contribution. Growth hormone for people with Prader-Willi syndrome is one example of a subsidised medication in Australia. If the individual wants a doctor of their choice or wants to go to a private hospital instead of a government hospital, they will need to pay a fairly large gap, and often they will ensure they'll take out private health insurance to enable this choice. Social support for people with a disability, including Prader-Willi syndrome, comes in two forms. One is that they can receive a disability support pension to pay for activities of daily living. This pension is means tested, so if the person with PWS has a lot of assets, then they can't receive that pension. The second thing is the National Disability Insurance Scheme. This new scheme will fund reasonable and necessary purchases of services to live an ordinary life. So what things can be purchased by this NDIS funding? There's assistive technology, early childhood intervention. You can get help around the house, support for an individual that's trying to find and keep a job. Personal care, such as personal hygiene and showering, things like that. Supported independent living means that if they're living out of home in a group home, then paid support workers are funded to come in and help them with their daily tasks. And just a few people can receive specialist disability accommodation funding. That is if you require a purpose-built house to suit your complex needs, which is often the case in Prader-Willi syndrome. And you can get help with medical aids. A brief history of the national and state associations. So in the 1970s, Queensland, New South Wales and Victoria formed associations. Later in the 80s, two more states, South Australia and Western Australia, formed associations. And then right through in 2006, those associations came together to form a national association. Now, in 2016, representatives from all the states and territories came together in Sydney to investigate amalgamating the associations. This group recognised the ongoing challenges about the unfairness of equity, depending where you lived in Australia. Some people got services and some didn't. The consistency of the message. If you were living in the big capitals, you got better service. So we wanted to instead deliver it into the local community where the person lived, out in rural and remote communities. And of course, we wanted to share scarce resources. The associations were doubling up on many tasks, and by pooling our resources, we would be better use of the funds. So this led to the relaunch of Prader-Willi Syndrome Australia as a limited company, a new charity, in 2018, and the company commenced trading in 2019. We formed a new vision, and I shall read it to you. An Australia where every person living with PWS, which of course includes their family as well as the individual, has equal access to high quality supports to enable them to be included in community, to achieve their goals and live happy, healthy, fulfilling lives. Our new mission, and I'll read it again, we exist to empower those impacted by PWS and to improve their quality of life. Now, again, we believe that the families are impacted as well as the individuals. So we want to empower both the families and the individuals with PWS. We aim to simplify pathways by connecting, educating, advocating, and transforming lives together. Now, together is a very important word here because we believe that the journey on your own as an individual is extremely challenging. But if we come together, we can improve that journey and transform the lives by helping and assisting each other. We have some new values. And this is our structure. You can see we've got a board of directors out on the right there. We've got a people with PWS consultative group, which I'll talk about a bit more in a minute. We have the project and operations manager, and the board has also formed subcommittees. We've decided on 4 different subcommittees: membership and resources, marketing and public relations, fundraising and finance, and grants and projects. We've managed to receive a grant from the National Disability Insurance Scheme to build organisational and individual capacity. So the NDIS funds for organisational capacity enabled us to write a strategic business plan, form those committees and subcommittees that you saw a moment ago. We've established many policies and procedures, which I think are vital for the integrity of the organisation and the smooth running. We've secured funding to seek and secure fundraising licences. It's a bit complex in Australia because each state has a different licensing system for fundraising. Yet when you do a national campaign, you're covering every state. So you have to register in every state. We've employed our project and operations manager, and we're renewing the website, Facebook, Twitter, and YouTube. And we're undertaking educational support activities. Now, the individual capacity building, that's the individuals with Prader-Willi syndrome. And an observation that I may have made before in this group is that the average life expectancy varies enormously from country to country. In some countries, it's only a few months or a few years, average life expectancy. Yet in Denmark, for example, it's around 65 years. So why this big discrepancy? Well, I believe the main reason is knowledge. So we need to get that knowledge out to all aspects of the Prader-Willi syndrome community. And then following on from the gaining of that knowledge, the knowledge might be diagnosis or treatment or healthcare or support practices. Once that knowledge is out, then the average life expectancy starts to improve. So we've started with some fireside chats. We have Zoom meetings and webinars. We invite people from around the world to experts and local experts to speak to the families, again delivering with technology into the house and the business where they're living and operating. And we've also established Our Way of Life Australia. Now, this group, Our Way of Life Australia, or OWLA, is more or less based on the United Nations Convention of the Rights of People with Disabilities. We want to enable them to find their own voice and to build their own skills. So the group will focus on their ideas and their opinions, starting to help us in designing what their future is going to look like. We want feedback from them on what we're up to. We hope that they'll have opportunities to speak out and to be heard and to build their confidence in doing so. And what other sort of activities might they do to achieve these? Well, we might make a series of short films or set up chat groups for them to talk to each other. They've already started making new friends in the groups. It's great to hear them talking among themselves too. And next minute they'll be holding up their pet dog or something for the others to see. Building new skills, and they're going to hopefully run their own conference in the near future, as has been demonstrated to be possible by our German colleagues. We have three main pillars of the new company. Education and information is one of those pillars. So you can see there we're working with researchers on newborn blood spot screening to make diagnosis a simpler thing. Clinical management, we're working with the hospitals to try and have similar processes to help the individuals to treat them. And then we're working with the support worker organisations that are funded through the NDIS to make sure that their supports are appropriate for the complex needs. And we're developing guides for that purpose. We would like to do more work around the 9 life stages and produce a brochure series. And we very much like the PWSA UK brochure series. However, if possible, we would like, and if we can get funding, we'd like to convert those into short films. Now, you all would recognise the shortcomings with written educational material. If you're working with someone with PWS, you've got no time to read the training manuals. So if we can convert them to videos, we would like those videos to be made using we're starring some people with Prader-Willi syndrome, so they're part of the making of the educational material. And then when those videos are being delivered, we want them to be delivered while the support workers, are sitting with the person with PWS. Now, we've set up one pilot program where there's a QR code on the wall of the house where the person lives. Support workers can use their mobile phone to click on the QR code, which takes them to a Google document. Now, of course, we can change the Google document at any time. The QR code stays constant. The Google document can be updated. And the links on the Google document will take them directly to the YouTube channel of the individual where the training videos are. So then they can sit on the couch with the person they're supporting, watching those educational videos. So made in the presence of the person and delivered in their presence as well. Project ECHO, well, this community is part of Project ECHO. This particular group we're in is leadership, but We also would like to start a health worker one in Australia. Advocacy and support for research. There's a lot of things happening there. We're trying to get some mentoring going. Fundraising, give the local communities the opportunity to do fundraising for the national organisation. Work on teamwork and promotions and support individuals with their efforts with individual promotion as well as doing national promotion. And advocacy is a huge ongoing role of an organisation like ours, and I'm sure yours. We're going to try and connect up the PWS communities across Australia and bring in international groups like yourselves, both on face-to-face and using technology. The PWS communities across Australia, there's a lot of work still there to be done to bring them all together. And I've already spoken about our Way of Life Australia, the ALA group. We enjoy the strong relationship we have with IPWSO and with yourselves, the other national associations. Hopefully that can grow even more. And we also try and make contact with Australian similar-minded support organisations. We've been particularly doing that with the 15th chromosome, partly because we've been researching newborn blood spot screening with those groups that who work specifically with people that have 15th chromosome disabilities. And we also work with the Prader-Willi Syndrome Research Foundation of Australia. At the moment, they're trying to develop a centre of excellence at a major medical centre or a university, but that's still ongoing. It hasn't been established yet. Now, the idea of that is that using technology, those experts then can reach out right across Australia and hopefully deliver services into the local communities, rather than the old model where the individual with PWS has to come to the hospital. We hope the Centre of Excellence can reach out right across the country using technology. And so that's where we're up to with Prader-Willi Syndrome Australia. Unfortunately, our website there, I've got it there, but at the moment we're having a little bit of trouble with it. We had a bit of a virus attack and haven't quite got over that. And as you can see, we've also developed an Australia specific 1-800 number. So that's one of the free call numbers that people in Australia can use to give us a call. Thanks for your time and listening today.